Susanna was staying at her boyfriend Steven's house when her first seizure occurred. Things had been generally normal towards the beginning of the night. However, as the night progressed, Susanna's condition went downhill. Susanna also experienced a seizure on the epilepsy floor at New York University's hospital. Since she had a second seizure within the span of a week, it is likely she would develop postictal psychosis. Similarly, Miss T had 3 seizures within the span of less than a week. Miss T and Susanna both experienced multiple seizures within a short period of time. Therefore, doctors diagnosing her with postictal psychosis is reasonable.
Susanna was experiencing wild hallucinations during the beginning of her illness. Such hallucinations included her believing that news anchors were talking about her, when they clearly were not. The woman who was diagnosed with the disease, Miss T, also had such extreme hallucinations. However, hers were physical, such as visceral hallucinations in the form of unpleasant sensations that appeared to arise from her abdomen and groin, combined with voices emerging from her abdomen. These similar symptoms would make it logical for doctors to diagnose Susanna with postictal psychosis. In this case, despite the two women actually having a difference in disorders, Miss T and Susanna shared the common symptoms of hallucinations and repeated seizures, making postictal psychosis a reasonable diagnosis at the time.
Commonly, people suffering from postictal psychosis do not act as themselves and adopt separate personalities. Such experiences are evident when Susanna addresses her family with accusatory words, like when she snapped at her stepfather, Alan, when she falsely convinced her that he called her a slut. Susanna clearly did not act as herself during this exchange. Mood changes mixed with hallucinations again made postictal psychosis a reasonable diagnosis for Susanna. Miss T also claimed that she did not feel herself to doctors when she was in the hospital, clearly displaying similarities in their conditions. The identical symptoms between Susanna and Miss T made it seem as though Susanna was correctly diagnosed, with no differences occurring yet.
When Miss T's postictal psychosis progressed, she began making declarations of suicidal intentions. Susanna made no such declarations, nor did she display any intent of harming herself. Instead, she progressed further and further into a catatonic state, one where her movements were stiff, delayed, and uncoordinated. Like Susanna, in order to address her various issues, Miss T was prescribed low doses of medications used to treat numerous ailments like seizures, nerve pain, and emotional and mental conditions, after which Miss T's psychoses were resolved. For Cahalan, on the other hand, her seizures simply stopped on their own after the 2 major ones she had, but her catatonia continued. As postictal psychosis is caused by series of seizures, often with chronic epilepsy, something Susanna did not have, her symptoms did not align anymore, and her illness proceeded to progress away from being thought of as postictal psychosis.
In all other postictal psychosis cases, the patient continues to have hallucinations for extended periods of time. Miss T's hallucinations came in the form of unpleasant sensations on her body, and then later she began to hear voices coming from her abdomen. Not only did her original symptoms continue, but she also experienced added complications 24 hours after her third seizure. Unlike Miss T, Susanna did not have hallucinations for long periods of time, rather in bursts, just once or twice a day, such as her hallucination about her being on the news. In addition, because of Miss T's overlapping hallucinations, she developed an irrational emotional response to situations created by her own mind, like her becoming homosexual and her being responsible for the suffering of innocent people. Susanna, on the other hand, regressed to an emotional state where she experienced severe detachment from reality, the opposite from Miss T.
When Susanna was finally diagnosed, it was discovered that it was anti-NMDA receptor encephalitis plaguing her, not postictal psychosis. While postictal psychosis is caused primarily by a series of seizures, anti-NMDA receptor encephalitis is caused by an inappropriate immune response. This type of response sent Susanna's immune system askew and induced a response in it that forced it to attack the right hemisphere of her brain. However, her doctor, Dr. Nahar, suspected something like this was happening and used a simple test that only involved her drawing a clock to confirm his suspicions. The clock test revealed that the right hemisphere of her brain was inflamed. She drew all the numbers on the right side of the clock, signaling that she could not properly connect the right side of her brain to the left side of her body.
As Cahalan's condition continued to worsen, she began having trouble with her short-term memory. Short-term memory is a problem in the part of the brain called the hippocampus. The anti-NMDA receptor encephalitis was attacking this part of her brain, causing her memory issues. Cahalan recalls watching videos of Ryan Adams over and over again while she stayed in the hospital, while not actually remembering the scene she's seeing. It was as though she was watching the video each time for the first time. Miss T never reported having trouble with her short-term memory, nor did she mention any gaps or lapses in her recollection of her experiences of postictal psychosis. These major differences in behavior further the gap between Miss T and Cahalan's illness, making postictal psychosis a misdiagnosis.